If you still have long-term post-COVID syndrome, you must watch this video. Watch it from the beginning to the end. Hello, I'm Rachel Lau, a TCM practitioner in Sydney. Recently, I have read a journal from the National Library of Medicine. It is the largest medical library. I was so excited when I read this journal article because it mentioned how to use Chinese herbal medicine granule to help patients with long-term COVID symptoms. Usually these patients, even if their COVID test results have gone from positive to negative, they still leave behind many residual symptoms such as short breathing, chest tightness, wheezing, insomnia, body ache, dizziness, and other different kinds of clinical symptoms. You can open the link below to see this journal article. How did they design the study of Chinese herbal medicine granule used to help this type of symptom? Well, they divide these people into two groups. One group used Chinese medicines. The other used a placebo. Then observe the results. Both groups have the selective criteria. That is, they all suffer from long-term COVID for a period of time. They also have consulted Western medicine doctor and also took different Western medicine drug for quite a long time, but didn't get a good result. In UK, they also conduct a clinical trial at the same time. They conduct a clinical study on those long COVID patients who receive acupuncture once a week for 6 consecutive weeks and observe the results of acupuncture. Although they say they have to wait until 2025 for a detailed report to come out. However, there's a report from researchers that some patients participating in the clinical trial do seem to be responding. That is to say, they have already seen effective results. As a TCM practitioner, seeing this report, I'm really excited, even though we know that it can help. But when such authoritative reports come out, their influence and persuasiveness will be even greater. During the past 4 years of the COVID pandemic period, our clinic stayed open, except for about 2 weeks in which we have to follow the directive from the government. We were not afraid at all. Why? Because when your immunity is strong, your body will naturally fight against these pathogens and virus. We have a saying in TCM quote, "With upright chi stored, evils cannot prevail." What does it mean? It means our upright chi energy is sufficient to fight with this virus. This upright chi is what Western medicine calls the immune system. Of course, not everyone's immunity is so strong. I know an accountant. I know her for over 10 years. In the past 4 years, she often gets vaccinated against COVID. She still got COVID several times and also been taking Western medicine drug for a long time. She always complains she feels tired, non-stop coughing, lost weight, and she's so afraid to contact with people. So she decided to work from home. I say, hey, that's not right. If you didn't see any improvement with Western medicine, why didn't you try alternative like Chinese medicine? I even offering free treatment to her. I know it's not about money. She's a bit skeptical, and she didn't even take my offer. And soon after, she gone with the wind. I completely lost contact with her 2 years ago. I don't even know where and how she is now. Well, Coming back to the topic, when your immune system is not strong and you have these lingering symptoms or a long-lasting cough, wheezing, difficulty breathing, etc., and you already tried Western medicine that long, shouldn't you try other alternative medicine? In fact, in Chinese medicine, there are many expectorant herbs. Some dispel flame heat, some dispel cold flame. There are no one type of Chinese medicines that can cure all coughs. We have to diagnose and treat differently. For example, we have to see if the cough is a cold cough or a heat cough. If you buy and use the wrong herbs, you could make the symptoms worse, and it's worse than not using any Chinese medicine. If the flame hasn't cleared up after a long time, and you just try to stop the cough, whereas the flame is still accumulating in the lungs. The flames in the lungs have no way out at all, and that can cause more other problems. So we must expectorate the flames first. Then the cough will slowly stop. If the flames stay stuck in the lung, it will gradually turn into bronchitis or even pneumonia, especially with lingering symptoms of long COVID. Because when flames become excessive, it may lead to a condition known as white lung disease, which means that one or both lungs are filled with fluid due to the infection. When the lung exudative fluid have occupied 70 to 80% of the lung, at this point, you will suffer from hypoxia. You'll be in serious danger. Western medicine's treatment method for white lung disease for the long COVID sometimes are not very effective. 2 years ago, I did release few formulas to help with expectoration and calming the coughs. As of today, 2 years have gone past. We TCM practitioners need to consider timing and conditions, as the current atmospheric influence are different from 2 years ago. So we have made some adjustments to the formulas. One is called Long Formula 1. The other is called Long Formula 2. They are formulas for the cough from long COVID to help with expectoration and stopping the cough. It's always the same phrase. You can't just take any formula at random. Taking the wrong one could worsen the condition. If you are unsure which formula for your symptom, you can simply take some pictures of your tongue and send them to us to have a look, whether you should use long formula 1 or 2. As for acupuncture, because it involves finding an acupuncturist locally, so I won't discuss it further here. If you still have these lingering coughing symptoms, or if someone you know does, please share this video with them. Alright, hope this video can help. See you next time. Bye then.